My name's Vinay Rane. I'm an obstetrician and gynaecologist and currently serve as the Federal Secretary of the National Association of Specialist Obstetricians and Gynaecologists. I also work as one of the subdivision chairs for the Australian Medical Association right here in Victoria. Together with my wife, Dr. Chris Sammartino, we serve Melbourne's community through our 3 private consulting suites at North Melbourne, Altona North and soon to open in Epping. Also alongside my wife, we raise our 3 wonderful daughters who are the absolute joy of our existence. Often when people come and see us for the first time, our patients have done a little bit of homework, and for years, one of the first things that would pop up whenever our names, as in my wife's name or my name, was searched, was the fact that our second baby, Leela, was born in the car. And that was a pretty remarkable morning. I can still remember Chris saying that she'd felt a couple of niggles, and our older daughter, Asha, was really keen on getting to daycare. She loved that place. And I said to Chris, look, should we go straight to the hospital? She said, no, we've got plenty of time. And so I remember dropping Asha off to daycare, and then on the way out, I came to find Chris jumping up and down outside the car, saying that these are getting pretty bitey. So I thought, well, we're only 5 minutes away from the hospital, how hard is this going to be? But boy, things picked up quickly on the drive, and Chris said, you know what, I think I really need to push. And I said, no, everything's going to be fine. Really did my best to try and mansplain my way out of it. And she said, no, I think I can feel her head. So I thought, no. So I pulled the car over and said, look, everything's going to be fine. There's no way there's possibly a baby. And sure enough, there was a head right there. And Leela wasn't going to wait for us to get to the hospital. And sure enough, she decided to be born in that car. And that was kind of terrifying, but at the same time, it was nice because it was just the 3 of us for a period of time. We were able to enjoy that aspect of things. Leela certainly hasn't changed. She doesn't wait for anything, even now. And that car ended up on car sales quicker than a New York minute. We were both working people when we found out that we were pregnant, and so to that end, our time was important. We had to sort of juggle work pressures, social engagements, as well as looking after the pregnancy as best we could. And to that end, we've really thought hard about how we can minimise the amount of time our patients spend in waiting rooms or looking for parking or commuting, and maximise the time that they're with us. I can still remember when we first found out that we were pregnant, and it's a really magical kind of time. It was like Chris, my wife and myself just had this little special secret that nobody else sort of knew about. We were both working in a busy hospital at the time, and it seemed that no matter what happened around us, we sort of had this precious secret that nobody else knew about to sort of hinge back to. I'm pretty sure for the first 3 months of that pregnancy, I wandered around the hospital with a ridiculously goofy smile on my face that made people probably wonder what was going on in the rest of my life. One of the things I really like about my job and looking after people at this really, really fascinating part of their lives, it's an exciting time. It's a time that is fraught with a little bit of anxiety and trepidation because you don't know what's going to happen. But by and large, it's a good time, a really, really happy and exciting time in people's lives. And to be able to share that with them is a huge amount of fun. Most of the people in our family are involved in healthcare in one way or another. And certainly, it's an absolute privilege to be able to share a practice with my wife. We certainly spend a hell of a lot more time seeing each other at work than we do at home. Our kids are often at the practice. We encourage our patients to bring their kids to the practice. And for us, it's a hell of a lot of fun, and it's a real buzz for us to be involved with people's families. It's a family-related specialty, and it keeps us young. We've got young kids and women of all generations in and around the practice. Our dog comes to work with us. So for us, it really is just an extension of our home life being at work. One of the other advantages of working in a practice where my wife works is that we often have patients that are shared. Chris is an obstetric medical physician, so she looks after complex medical disorders in pregnancy. She has a special interest in hypertensive disorders in pregnancy, like preeclampsia, as well as lupus and a bunch of other medical conditions that I can't pronounce nor can I understand. But it does also mean that not only are our patients better looked after when they do have those sort of complex medical problems that require specialist input, but it also means that there's a real continuity of their care through our practice. We're involved in probably some of the most intimate and some of the most exciting phases of people's lives. You know, nobody forgets having a baby, and it's a real privilege for us to be involved at that stage of life. But for me, it wasn't so much the miracle of childbirth that drew me to this specialty, but it's the little individual stories that I think I take with me. Whilst every pregnancy that we look after is really, really special, every now and then we come across a pregnancy that is that just a little bit more precious. We do tend to take care of lots of women in different segments of the community. We look after a lot of working mothers and working women. We look after a lot of professional athletes. But for many women who have delayed their fertility journey till later, it can be a particularly stressful time. Another real advantage of working in this industry is the capacity to see my patients at different stages of their lives. Sure, I can see them in my consulting rooms. I can often see them in the hospital, whether that's on the ward or in the special care nursery with their newborn babies, or I might even be seeing them in theatre, whether they need an operative procedure or whether they're having a baby. But also I get to see them in the community, living their best lives. So I can see them at the shops, I can see them at the market, I can see them on the beach. But for me, that's a really, really great bonus of what I do. It's a real personal thing. And most of our patients, like I've said before, are really extensions of our family, and they well become our friends as well as our colleagues. I guess when setting up our practice, we actually looked at personal experience. We looked at the things that made our pregnancy journey happy and fun, and also looked at those things that we thought we could do differently. Sometimes the world and the universe will throw in some unexpected features, like they did for us, and we had a baby in the car. And for others, we try and control the environment as best we can, and do things as safely as we possibly can, and that might mean having a cesarean section. Despite having been doing this for the best part of the last quarter of a century, every day brings new challenges and a great deal of new experiences for me, and I can't wait to see what happens next.